Hi, my name is Marissa Twarowski-Klinger, and my capstone project aimed to support children with gastrostomy tubes and their families post-discharge. My site mentor was Erin Cochran from the Child Development and Rehabilitation Center, also known as the CDRC, more specifically in the Feeding and Eating Clinic, and my faculty advisor was Caroline McCarty. To touch on some background information about my project, first and foremost, optimal nutrition is a universal need for all humans, but especially during those early stages of life when there is such rapid development going on. Enteral nutrition, also known as EN, also known as tube feeding, is a medical intervention offered to implement and support children who are unable to consume the appropriate diet for their age to support their development. And managing a child's tube feeding care at home is very complex and often imposes significant stress on caregivers and families, which impacts their quality of life overall and impacts their routines, things like that. Lastly, families have a strong support with EN while in hospitals. They get trainings, they have nurses around the clock. However, they are commonly discharged home with limited guidance and left to navigate the complexity of EN alone. The purpose of my project was focused on helping to support families transition home and provide additional guidance and bridge that gap between hospital and home and make that transition a little more seamless. Also, I wanted to support children and families' knowledge about navigating their feeding tube journey post discharge to increase that confidence and overall quality of life. And then develop and disseminate resources to help inform, guide, and connect families once they have left the hospital by incorporating lived experiences from other tube feeding families and the input of various health professions. Additionally, my purpose was to create a guiding feeding tube toolkit for practitioners and also utilize the OT theory to guide resource development throughout my capstone project. The theory that guided my thinking the most throughout my project was the person, environment, and occupation, also known as the PEO model. This helped me to maintain a holistic approach through the entirety of my project and also emphasize the relationship between the person, environment, and occupation, and really recognize that that's a transactional and ever-changing experience. Additionally, I kept in mind the compensatory frame of reference. This addresses the utilization of a feeding tube device to facilitate independence for families and children in regard to the occupation of eating despite dysfunction. The program development process began with a literature review, where I dug through multiple databases for current literature on family and child G-tube support after discharge. Next, I executed a needs assessment for the CDRC feeding clinic to identify areas of need. I then observed the CDRC feeding clinic, reviewed their current resources, and researched G-tube care and support resources. And then I developed client and family handouts and clinic provider resources using the PEO model and the compensatory frame of reference to guide the development of those deliverables. And lastly, dissemination. I presented the resources to the practitioners at the CDRC feeding clinic. The outcomes of my project include the development of Epic Smart Phrases for the CDRC feeding clinic, which has resources that can be provided to families navigating G-tube life. I also created informational and support handouts. Those included frequently asked questions, which were all based off of information gathered from the feeding team, such as GI, dietitian, speech and language pathology, DME, things like that. I also created a G-tube tips and tricks handout, which included all kinds of fun things that might make navigating the G-tube life at home easier and more fun. And then I also created a family perspective and advice handout, which just really answers the question, what G-tube families wish they had known, and tips from G-tube families, which I gathered through direct interviews with families that have navigated G-tube life for years. And lastly, I created an OT toolkit for OTs who may receive feeding referrals, which includes feeding evaluation questionnaire, a feeding focused guiding question cheat sheet for OTs, and then also included is the family advice resources that I talked about previously. And then if you scan this QR code, it will lead you to all the deliverables that I created so you can get a deeper look and maybe a more clearer look at what I created. Here is a close-up of two of the deliverables that I created. The one on the left is the actual feeding evaluation questionnaire template that I created, but included our general guiding questions that aim to enhance the evaluation process and obtain a more comprehensive understanding of the patient and their family and additional factors that influence the feeding and eating experience for OTs who may receive a feeding referral and are not familiar with that area of practice. And then on the right is a tips and tricks and ideas for G-tubes handout. This kind of informs families of what kind of adaptive equipment and items are out there that may help navigating G-tube life easier. Impacts of my capstone project include improving confidence of navigating tube feeding at home, ease the transition from hospital to home, enhance information, support, and connections for children with G tubes and their families. And then resources developed for families were created using health literacy principles such as plain language, clear formatting, and multiple formats to promote accessibility and to educate more families with children with G-tubes. There are 5 main themes that I gathered throughout my project. One being pediatric feeding tube care is complex and impacts the entire family significantly, altering their roles and routines. This includes both internal and external factors. 2, supporting family and caregivers directly supports the child and enhances health outcomes. 3, incorporating lived experiences adds meaning and value, making it easier for families to relate, connect, and understand information. 4, utilizing a multidisciplinary team approach, pediatricians, nurses, OTs, PTs, etc., allows consistent education and recommendations for families and reduces the gap in care. And lastly, health literacy considerations are crucial. It is important to consider the characteristics of caregivers, such as age, skill level, and education level, when addressing a topic, and adjust it to meet the unique needs of caregivers and patients, if appropriate, to ensure that they understand. The CDRC had limited available handouts or written materials to support families transition home with G-tubes, and early evaluation with the site indicates that the resources developed are supportive and beneficial. Next steps and limitations include offering a hands-on class for parents and families to practice placing a G-tube, either on a doll or on their own child. This is something that came up a lot during my family interviews as something that would be beneficial for them. Next, local community events to better connect G-tube families is needed. Community is so important, and G-tube life is so complex that really building a community of G-tube families would be super powerful. There needs to be more emphasis on cultural perspectives and cultural backgrounds when dealing with different patients. And then also for limitations, there seems to be limited diversity of the patient population when collecting data. I want to say thank you to the CDRC and more specifically the Feeding Clinic team, Erin Cotran, my supervisor, Tammy Bakewell from Family to Family, the G-tube families that I interacted with and got to meet and pick their brain, the OHSU feeding team, including GI, psychology, dietitian, SLP, pediatric surgery, DME reps, and GI psychology. If you'd like to see my references that guided my project, you can scan this QR code right here. Thank you. Thank you for taking the time to learn more about my capstone project. Please feel free. I actually encourage you to scan that QR code so you can really dive deep into the deliverables that I created. And I thank you for this opportunity.